TikTok strikes again, and this time it's showing users how to remove skin tags at home. Well, and joining me to discuss this trend is dermatologist and friend of the show, my colleague, my dermatologist, Dr. Sonia Batra. Welcome to the show.
Thank you so much for having me. Great to see you, Dr. Orden.
So what's your read on all these trending videos when it comes to skin?
When I see these videos, it makes me cringe. And the reason is you're not always accurate when you just look at something visually. And so when you see these videos, what they're doing is they're taking a string and they're tying it at the base of something and you're choking off the blood supply. So whatever it is above the surface is going to die and fall off. But the problem is it's not always straightforward. These aren't always harmless tags. And when people do this, they may be choking off a mole, they may be choking off a skin cancer. It's just uncertain, and that's the real danger.
In a nutshell, can you tell us the difference between moles and skin tags?
When we talk about moles, we're actually talking about clusters of pigment cells. They can be brown, they can be skin colored, but those are much more problematic. And the big concern with a true mole is if it's evolved into skin cancer and you lop off the top of it and you have that fall off, you may delay the diagnosis. You're still leaving the roots there, and it could be something really problematic. And then you're really taking a much longer time to see it come to a head so that it can be diagnosed accurately. And tags, just a little harmless overgrowth on a stalk of skin, and you might see it under the arms, we see it in the inner thighs, you can see it on the neck, anywhere where you might see pressure rubbing, even under the breasts of women, but those are harmless and safe.
Right. I mean, it's all about making a diagnosis. That holds true in all of medicine, but in skin, you have to get that diagnosis. That's why you go see Dr. Batra. The first thing she's going to do is biopsy something and get a diagnosis, because even if it's benign, it may involve a bigger treatment, a bigger excision, etc. So don't do it. Don't do it yourself at home. Go to the professionals. We've been talking about a TikTok fail. Well, let's go to a TikTok triumph when one woman took matters into her own hands and circled her husband's concerning moles before sending him off to the dermatologist for a mole check. And what's even better is the derm actually wrote notes back to her about biopsying some of them. So, Dr. Batra, what do you think of this woman and her tactic?
So I actually love this tactic. This is social media done right, because she may have watched a video, she may have read about this and kind of had a good sense of what to look for. But then she's flagging it for the professional. And I actually see this all the time in my practice, especially when people get nervous at the doctor. It's a great way to remember to flag something that when you're there and in the moment you might not bring up. It's also concerned spouses. I see a lot of wives do this because they're not sure their spouse is going to bring it up in the exam room. So they've seen something at home and they flag it. But I love it when people do this because it is a nice way to make sure everything that might be on someone's mind is brought to my attention. And then I also love that the derm in that video wrote a little note back, because that's sometimes the hardest thing, is to communicate to that concerned person what's going on.
Well, my wife's due to come back and see you next week. Maybe I'll do a little
you can write me a little
magic
note.
marking. Not that I don't trust you, Doc. You know what you're doing.